today to talk to you about brain spotting therapy and my personal experiences with brain spotting therapy. So let me tell you what brain spotting therapy is. Brain spotting therapy is a relatively new type of therapy designed to help people access, process, and overcome trauma, negative emotions, and pain, including physically induced pain. Brain spotting was developed through David Grand's work with survivors of traumas and many mental health professionals. Utilizing the approach have found to be an effective form of treatment for a variety of mental health concerns. How does brain spotting work? According to therapist and creator David Grand, the direction in which people look or gaze can affect the way they feel. During brain spotting, therapists help people position their eyes in ways that enable them to target sources of negative emotions. With the aid of a pointer, trained brain spotting therapists slowly guide the eyes of people in therapy across their field of vision to find appropriate brain spots. With brain spot being an eye position, it activates a traumatic memory or painful emotion. Practitioners of the procedure believe it allows therapists to access emotions on a deeper level and target the physical effects of trauma. There is an increasing evidence that trauma is stored in the body and it can alter the way the brain works. Trauma can, for example, have an effect on emotions, memory, and physical health. Brain spotting seems to activate the body's innate ability to heal itself from trauma. While a therapist may attempt to access both the physical and emotional locations of negative emotions, brain spotting therapists use something called dual attunement, a process through which the therapist stimulously innates to the therapeutic relationship as well as the brain-body response. The person in therapy, there is some evidence that brain spotting works primarily on the limbic system, a collection of brain structures that play a role in emotion, long-term memory, in conjunction, motivation, impulse control, and several other physical factors that can affect well-being. The development of brain spotting through his work applying somatic experiencing and eye movement designation and reprocessing therapy, Grand eventually developed what he called natural flow, a technique that integrated those two types of therapy. Grand used a natural flow proved to be beneficial to some of those he was treating, and he used it as part of trauma therapy he conducted with more than 100 911 survivors. He took this form of therapy further after one individual dealing with both physical and emotional symptoms of trauma experienced significant rapid improvement. Following a session in which he locked eye position enabled a cathartic expression of memory and emotion, Grand eventually developed a formal training, and today more than 8,000 therapists are trained in brain spotting approach, which a fast-growing area in the field of psychology. Now, how effective is brain spotting? Both brain spotting and EMDR therapies attempt to help those in therapy reprocess negative events and restrain emotional reactions. The older of the two therapies has been more intensively studied, but therapists are increasingly practicing brain spotting and repositioning. Reported to help a variety of physical concerns. Brain spotting is a preliminary use trauma therapy and for the treatment of PTSD. It has also been shown to assist in injury recovery and help treat physical intention, stress, and low motivation. Some therapists believe psychological issues such as anger, procrastination, and difficulty concentrating, among others, can be caused by trauma. Therefore, brain spotting may be a particularly effective form of therapy for those individuals who wish to address one or more of those concerns. Who can benefit from brain spotting? Those who have experienced either physical or emotional trauma may benefit from brain spotting. The forms of therapy has been shown to be effective treatment option for those experiencing trauma. Okay, also, it's all forms of trauma, anxiety, attention, ADHD, anger issues, phobias, substance abuse, chronic fatigue and chronic pain, impulse control issues, sports performances issues. Limitations of brain spotting. Though a large number of individuals report positive results from brain spotting treatments, this is a form of therapy is relatively new, and further research will likely be of benefit. It is difficult to compare the efficiency of brain spotting to other approaches because few studies have been done on this particular approach. Brain spotting is still increasing in popularity among therapists and people seeking treatment, but is still not as well known as other treatment approaches. So that is brain spotting. Okay, and what it is to me, in my opinion, because I have been brain spotted many times, because I have been through a lot of tragedy. What it is you focus your eyes, you look across the room, and they have like a pointer, a long pointer, and you follow the pointer, and they find the spot. You find a spot where you can feel pain or trauma, and you listen to. They put headphones on you, and you listen to like music or like birds or the sea, and the room is dark, and it's like a hypnotism. It's like you're almost under. You're very relaxed, and when you're done, I feel a lot better. I feel well relaxed. But while you're under, you feel your body like twitching, like this and that, and all kind, and that is trauma releasing itself from your body. And I live by this. This is how I get along, because as you all know, I just recently lost my son, and I have to find a way to get this trauma out. I mean, it's not ever going to go away, because nothing like that ever goes away, but to get the trauma out, I don't want it locked inside of me for the rest of my life. So to get it out is a good thing, and I think all around that this brain spotting is a good therapy for anybody, like I said, that is having issues with trauma, even back pain. I use it for back pain too. And the day that I have it, like I said, it lasts about an hour. They have you under for an hour, and when you get home, you're so relaxed, so you feel so good, and the trauma is coming out. You have to, I sit around and relax all that day, and I can feel my body still jumping, and nothing terrible, but it's just, I think it's the way to go if you do need treatment. Or just go see your therapist. But like I said, I swear by it. I know people that do have it, and also like it gets you through. I mean, I'm telling you, it gets you through some hard times, and I recommend it. And this video is in no way medical advice or anything like that. I'm just telling you my personal experiences. I mean, every time I do go under, I do feel my body jumping. It's kind of scary sometimes, and you see things, you hear things, and you're like in a trance. So yes, that's what I have to talk to you about today. Thank you for watching my video. Until next time, and thank you for watching. Until next time.